Hello, everybody. My name's Emily. As Campbell said, I'm a health coach, also a healthcare assistant and a receptionist at Queen Campbell Medical Centre. So I qualified as an OT back in 2002, before I worked in various hospitals and community settings up until I had my children in 2007 and 2008. At that point, I was 8 stone heavier than I am today. So I've kind of been through my own, I have been through my own personal journey along the way. Decided I needed a career change, so took up a role as a healthcare assistant at Queen Campbell Medical Centre, and my role has continued from there in reception as a health coach. Huge passion for health and fitness now. And last year I was approached by one of our GPs to try and tackle our pre-diabetics, our 42 to 48 people that need to do something about it. So anyone with an HbA1c of 42 to 48 previously were deemed normal. The person would phone up and receptionist would say, yeah, that's normal, that's fine, you carry on what you're doing, think no more of it. But actually, those are the people that can make a huge difference. Alarm bells at this point should be ringing. So anybody in this range, or a GP or a practice nurse who feels that would benefit some coaching from me, are asked to come and see me. So Postman Pat helps me along the way, and we send out anybody who's sent a task to me a letter inviting them in for a 30-minute consultation. We have had an amazing response rate of about 65% of people just coming in from that letter, which to me is pretty impressive. And a key to that is the wording. There's a lot to read there, so if you want copies of this, what we've been saying to patients, you feel free, we're very welcome. But it's really saying to people, you can do something about this. This is scary, but we can help you along the way. We try and motivate people for change and get them to turn it around. So they come and meet with me for half an hour, and I explain in very simple Emily terms, which are always very simple, what the HbA1c actually means. It's all very well banding around these numbers and these letters, but these poor patients, they often sit there and think, what are they on about? Don't know. So I explain to them what it means, and if they understand a little bit of the science behind it, hopefully they will then be more proactive and motivated to make changes because they understand why they are doing it. I use Peter's, the pictures of all the sugar teaspoons. I haven't put a slide up. I use that during the consultation, and that is really powerful to show people, I heard you all go, 24 teaspoons, that's amazing. And it is. You can show people that they can make a difference with a few tweaks and changes, it's very important. Tesco's, Sainsbury's, all the supermarkets have great nutritional values. You can say to them, give me a food item, and you can type it in and it will show you the carbohydrates per 100 grams. And that's a really useful tool that I use, as well as food labels. So they go away with very, very little information from their consultation with me. In fact, it's pretty much this piece of paper from the Public Health Calibration and their results. And what the aim of this is to empower them to show that they are the ones in control. We give them the tools, we show them where they can go and look for that information, but it's up to them to make the change. I can't come and make every meal for them and tell them what to eat. So it's encouraging people to take their own responsibility. So, Public Health Calibration UK, if you haven't looked at their website, don't know anything about it, go. It's amazing, it's fantastic, and it's a great source to help your patients. We look at what the patient's been eating, what they could be doing differently. I do explain to them about carbohydrates, but then we go through their daily menu, what they would be eating, and attempt to make some alterations between us. It's a conversation. It's not me sitting dictating to them what I think they should be doing. This is up to them. This is their goals. This is their life. So we help them set goals, making them realistic, achievable, all the rest of the SMART goals. but it needs to come from them. It might be really important to me, and I'm thinking, you should be changing that, you shouldn't be doing that, but actually, no, they want to do something different. One example, I had a lady who came to see me because she was in the pre-diabetic range. She went away and she gained 7 kilograms, but she stopped smoking 3 months later when she came back to see me, and that was brilliant because her goal at that point was not to tackle her diabetes or pre-diabetes, it was to tackle her smoking. And then the next goal from there was going to be, what is the HbA1c. So the patient then leaves me, full of excitement, motivation and knowledge, and they go away for 3 months, but they are invited at any point to make contact with me during office hours. They return for a review 3 months later, where we repeat the HbA1c, height, weight, blood pressure, cholesterol, etc. And then we can reflect, review and plan and see where we go from there. We have had some amazing results. And to be fair, this is the average, it doesn't do it justice, but with our probably 150, 160 patients, the average reduction is 1.5. And this is just from half an hour with me. And an average of a 2.4 kilogram weight loss. So bearing in mind, you've got some people who've gone away and ignored everything I've said. Some people have done a brilliant 10 kilogram plus weight losses and massive reductions from high pre-diabetics right into the normal zone, as we've all been sharing some of our great stories today. So to me, the magic, why does it work? Encouraging moderation. Don't let people think they can go and change the world. It's just making small tweaks and changes, things that we can make a difference. How we make up our plates. It's not going and changing everything that we're eating. It's explaining to people that a few different ways, less pasta, no pasta, more meat, more vegetables, it can make a difference. Again, a lot of people have said it this afternoon, diets don't work. It's got to sell it as a lifestyle. This is your lifestyle journey. It's not a diet. They just don't work. Having a very positive but interactive approach, I do think that makes a massive difference to people. We've had some great people bouncing back, as other people have said today. So there we go. Over back to you guys.